that there is a oh,
That's
I just got a notification. Hey, hey. Um, I am part of this committee because I truly feel that there's really a Venn diagram around youth experiencing this system. And I feel like this committee is really a part of really large conversations that are happening to move practice, to move policy, to better serve youth experiencing these systems. I am also a person with lived experience, and I've worked in this realm for about 8 years now. So I'm just really grateful to be a part of the conversation. And I will pop it over to Alex.
Hi, my name's Alex Island. I use she, her pronouns. I am currently a OPA2 in the I'm a operations integrator in the governor. Oh my God, I cannot talk today. I'm sorry. I haven't spoken a lot today. Uh, in the director's office for the Oregon Health Authority for Public Health Division. I've also previously worked as a child welfare caseworker or permanency caseworker. I'm here because of lived experience, both in the foster care system myself and as a child welfare caseworker. I did not do any resolutions this year because I'm really bad at following through with them, but just kind of overall trying to find more joy and having a good time in life. I will pass it over to Ashley.
Good morning, everyone. My name is Ashley Wortman. I use she, her pronouns. I work for the Department of Human Services. I work within the Office of Equity and Multicultural Services, or OEMS, and I am the Child Welfare Service Equity Manager. It's quite a title to, or a mouthful to introduce, but I'm here as a guest with you all today. I'm on your agenda to share about the Child Welfare Service Equity Council, and the work that's happening in that area. But happy to be here, and I try to join y'all when I can. I also don't make resolutions, but I tend to try to make short-term commitments and then continue building on them. So my first one is just to brave the cold and continue to get outdoors as much as I can. So I'll turn it over to Rory.
Hi, everybody. My name's Rory. I'm a pastor in Prineville, and I'm just a candidate for the committee. Really honored and glad to be with you guys. I'm a resource parent, although we don't have anyone in placement right now. And don't really do New Year's resolutions, but it's been a dream for about 7 years to do jujitsu, and I started in October with my two little kids, 8 and 10 years old. So we have been doing a lot of rolling on the mat, and it's been a lot of fun and building some good disciplines and things. So life goals, right? And let's see who hasn't gone yet. I think Anna, if I'm
maybe if you
correct.
haven't gone, just hold your hand or raise your hand up and
That
not your
Laura
actual hand,
Williams.
but your
Sure.
pretend hand.
You want to raise your Zoom hand so I'll know who to
Zoom
call on
hand.
after me. So I'm Anna Williams. I use she, her pronouns. I am the executive director of the Governor's System of Care Advisory Council. And I'm here as a guest today to talk to you about our omnibus legislation that we are partnering with the Oregon Department of Human Services on. And my New Year's resolution is always the same, and my kids make fun of me, but it's sleep more, get outside more, and drink more water. And I can always do better on those things. I will popcorn it over to Matt.
Hi there, my name's Matt McCaw. I'm a small business owner. My wife and I live in Powell Butte, which is a little tiny farm town over in Central Oregon. We are foster parents. We've been foster parents for about 15 years. We've adopted out of the foster system. I've had about 30 kids come through our house. So I'm also a candidate to be on the team. Excited to join a team that's looking to get better outcomes for our kids in the foster system. So glad to be here. It's nice to meet all of you. Also, don't really do New Year's resolutions. I will pop it over to Rachel.
Hi, everyone. Rachel Kearns Henry, she, her, hers. It's nice to see you all. I work with Governor Kotek as our human services advisor for her. In that role, just this committee really, I serve as that liaison to the governor. So a lot of the work that you're advising on, as you know, I pop in and you help to provide your recommendations to me, and I help to ensure that that gets to the governor as we navigate our improvement strategies ahead. So thanks for all joining on this cold day, and I'm glad that we have some new faces. I'll turn it over to Donna.
Hi everyone, I'm Donna Haney. I use she, her pronouns. I am the assistant manager in the foster care program here in Child Welfare, ODHS Child Welfare. I'm happy to be here, and I also am happy to see new folks and new candidates moving forward. I don't really do resolutions either, but I'm going to steal Alex's about finding joy. That sounded fantastic. So thanks for that. And I'll send it over to Michelle.
Hi there, I'm Michelle Pfeiffer, she, her, hers pronouns. I am the legislative coordinator for child welfare. I'm helping out the System of Care Advisory Council a little bit this year as well, and also the legislative coordinator for OTIS, which is the Office of Training, Investigations, and Safety. And my whole career has been centered around child abuse investigations and child safety in Oregon. Excited to see Matt on the call. Shout out to Central Oregon. I love to see regionality represented here because sometimes life is a little different, not in the valley and on the I-5 corridor. So love to hear that, and I will pass it on to Ellen.
Hi, welcome. I'm Ellen Bell, and I'm the coordinator for this commission. And I do make New Year's resolutions and intentions and a lot of things, but I try to make things very realistic so that they can be followed, and so that I can look at them as I go along each month and make sure that I'm keeping up with it. And similar to Anna, mine's really about sleep and rest and taking care of myself and finding joy and being outdoors and just taking time to enjoy what's around us in the natural world and be a part of it. And I am going to pass it over to Victoria.
Hi everyone, I'm Victoria. I am both an adoptive mom and I run a nonprofit to help support youth in foster care. So happy to be here. She, her pronouns, and my resolution / goal is probably just to be able to help more kids in foster care and, fill those needs. Thank you.
And Victoria, do you mind maybe putting in the chat just a little information so we can get that down in the minutes of where your last name or something like who you're with, your organization. Yeah. Thanks.
I'd love to. Thank you.
And we do need someone to take minutes today. So is there a commissioner willing to do that since we don't have Alicia with us?
I can take minutes. I will be honest, I don't know how good they'll be, but I'll give it my best.
That's perfectly fine. We also will have the recording to
Perfect.
rely on if we need to go back to that. But if you could just use your agenda and make some notes about, things like that. Thank you so much, Malik. Really appreciate that. All right, Jessica.
All right, thank you. I didn't see where there was a resolution, but I also don't have a resolution except for to survive this year. So, here we are. Okay, next order of business would be to adopt November's minutes. Did anybody have anything additional or anything that was missed, or are we good to adopt?
Probably need a motion in a second. Yep.
Can I get a motion?
I move to approve the November minutes.
Can I get a second?
I second.
Okay, thank you. Victoria, was your hand still up because you had a question, or was it just left up?
Sorry, I just left it up.
Okay, all right, just making sure. No worries. Okay, so the new business is the new applicants in the renewal.
We need all in favor. Just take the vote.
All in favor?
No oppositions. Okay.
No? Okay.
All right. Then motion carries.
Okay. So the new applications and renewals.
Basically, that's just we have 5 new applicants to the commission. They've been sent to the governor's executive office, and now they'll go on to the governor. We'll find out, who is put forward. We have 5 new people and 2 renewals. And our renewals, of course, are lovely Alicia and Casey, and very thankful that they'll be staying with us. And then 2 of our new applicants are on the call today, which is Rory and Matt. And we also have another Matt and a Jesse and a Tori, who are also new applicants. So, and possibly they'll join us today. I invited anybody who applied to attend, as well as this is a public meeting, so anyone who would like to can be here. So welcome to our applicants, and we're happy you're here. So that's that piece of the agenda.
Yes, welcome. Exciting. I think we're at full capacity right now.
We will be.
Yeah. So that's exciting. And then our monthly meetings for February, the decision on that, Ellen?
Right now, the meeting is scheduled for President's Day. As it turns out, we've never had monthly meetings. Now that we've gone to 1.5-hour monthly meetings, we realized that February 17th happens to be President's Day and a holiday. So we need to either cancel that meeting, or we need to postpone it till the 24th, the following Monday at the same time. And so that's up to the commissioners to decide what if you'd like to either postpone it till the 24th. We could do 11:30 to 1, if that works for everybody.
I move to postpone it to the 24th.
To the 24th. Thanks, Judge Chico. Any second on that?
Second.
Yep, I can do that.
Point of order, Ellen. Can we actually be voting on things with only 5 members present?
Oh, actually, let's see.
I think we have to have.
Oh, you are so right. Thank you for catching that, because we are missing our quorum. So we'll scratch those votes. So we'll have to postpone those minutes. Sorry about that, Jessica.
No worries.
About that.
Thanks, Casey, keeping us
together
over there. And then, Ellen, what are the upcoming topics for concern?
Yeah, that is up to you all. That's on there in case anybody has, if there's any legislation that has come up as a concern that you want to put forward to discuss at the next meeting, or if there's any other topics that people have right now. We'll be following up, of course, on anything that hasn't happened today. But because we've gone to this 1.5-hour meeting as opposed to the 3-hour meeting, we're trying to figure out how to consolidate. And today we do have Michelle and Anna, and we have Ashley to discuss some things. And so there may be some follow-up on that, but this is just an open question if there's anything else. Anything right now? Casey?
Yeah, so I wanted to, I maybe have brought this up in February, but I'm always interested in the children's outcomes. And one thing that we focused on a lot in 2024 was looking at some of the graduation rates and some of the correlation behind that. One thing that we found, which I've shared pretty widely, is the graduation rates are much more affected by school transitions rather than placements. But that's opened the door for so many other questions, such as how do those transitions affect you as a youth, pre-K, that type of age, younger than high school versus somebody who's in high school. And second part is, how do we balance that transition data with the amount of time that it takes to transport a child? And so, is it better to have a transition or to have an hour commute to and from school? And so we have as everybody knows, we have these best interest analysis on the school quite often. And every time a child changes school, we come back to court. And for years, it seems it was almost a rubber stamp. And now we're trying to have more discussions about it in court, which I appreciate, but we don't have the data to really back it up. And so we seem to always default to go ahead and approve the school change, knowing that it's probably not really in the best interest of the child, but we don't have the data. And so I would love to see if we can do a little bit more follow-up, whoever was driving that study.
Sure. And we could always pull OCID back in. We had the child integrated data set, see what new information they have. I can reach out to them. Also, I have a meeting, I'll be having a meeting with Catherine Seltzer next week, and we'll be talking about some of the new educational legislation, and then we can also do some follow-ups. She couldn't join us today because she's pretty overwhelmed with legislation right now, so there's tons of education bills. But does that sound like a good idea? Everybody jumped around and my eyes had to move again. I'm like, okay, right. All right, and I'll probably reach out to you, Casey, and see so we can pinpoint exactly what we want to be looking for from your angle. Okay. Great, thank you for that. Well, we're actually doing pretty good on time. Jessica, do you want to, should we move on to Anna and Michelle for the LC 346 update?
I'm sorry, can you say that again?
Oh, are we ready for the Anna and Michelle for the 346 update?
Were we deciding on talking about the secretary position, or we're not going to do that because we can't vote?
I'll probably do that in February.
Okay.
Yeah.
Okay. Then yes, we are ready for the 346. So Michelle, did you want to jump in and talk about that?
Yeah, actually, I'll have Anna start off. We kind of have a rhythm to this presentation now. So, or I don't know, Rachel, did you want to set the stage on kind of the governor's ask first?
Why don't we do that? Just because that's also part of our rhythm. And since I'm here today. So folks, I just want to note when I've been here before and we've been talking about what's been in what are we advancing for the governor's recommended budget. Just want to thank you again for all your letter and your suggestions for where we needed to invest. You know, a lot of the areas that we've identified, we need to continue to address how we have access to high quality child and family behavioral health providers. We need quality access for kids that are in foster care in particular. How do we think about kids that are going into temporary lodging, and we need to have alternate types of placements that are really truly meeting their needs. And part of our funding package that we do have for Department of Human Services, child welfare includes investments to continue building that work. We also, specifically, we have a $10 million funding category to really help looking at innovative placements that we need to make, in particular with some flexibility to allow the child welfare staff to look at more of the onesie, twosie types of innovative supports that you need. We also are thinking about the broader, bigger picture in terms of what's the overall statewide access issue that we have, and you know, child welfare many times is the microcosm of what's happening at a broader perspective. And the Oregon Health Authority, we have investments that we have included to help expand access for co-occurring diagnoses. If you have both SUD and a behavioral health need and you need residential treatment, how do we get the appropriate treatment capacity built? How do we continue to invest in the community behavioral health, et cetera? As we were building that budget and as we were navigating and saying, all right, what's next? The governor asked her System of Care Advisory Committee, who is advisory to both the governor and to the legislature, all right, folks, we're going to be doing these investments we need to identify the investments alone might not be sufficient. What are the policy changes that we need to consider to ensure that these investments can be meaningful, especially in light of the environment that we're all in, where as we've been here acknowledging that we just finalized an agreement with the Wyatt Collaborative Agreement, with our settlement, where we are identifying where and how must we be thinking about the transformation journey ahead and looking at investments and policy changes to improve quality placements, to improve access for mental health supports. She asked that committee then, with the work that you've been doing all these years, what are some of the most important things that we need to address in terms of the environment to ensure that we can have access for kids? And that's part of what you're going to hear about. And Anna's going to speak to a little bit about that with what the System of Care Advisory Committee does and the process that they've used for coming up with these recommendations. But I just want to make sure that we're helping to identify the context. While the bill that you're getting that we're noting, there's a lot of technical details and it gets into the weeds. But at a really high level, making sure that we're always grounded in why are we talking about these changes? It's because we do need to really be thinking about what's the overall environment and how are we building the system that we need in Oregon to ensure that we can have youth mental health access for all, but really also identifying our kids that are in the foster care system and child welfare system. How are we really understanding the unique needs and building capacity to ensure that we have providers that can support them? So I'll turn it over to Anna.
Thanks, Rachel. So, from that introduction, I think the sort of the important tie from what Rachel just described was the governor's office really coming to the System of Care Advisory Council and saying we do want to make some significant and important investments in the children's and youth behavioral health system in the 2025 biennial budget, which will come through the legislature. So if we're going to do that, what are the policy changes that need to occur for folks to be able to take the money and for the money to really be able to have the types of impacts that we've been looking for? So kids with complex case needs are actually getting treatment and care. Kids are getting the appropriate treatment and care. Right now we have some rigid silos within our service delivery structure that if you to Rachel's point, if you have a substance use disorder and an intellectual or developmental disability diagnosis, it can be very, very hard to get the appropriate treatment because folks will say, I don't have the expertise to provide SUD treatment for somebody with IDD. And so what a lot of young folks, and I'm assuming many of you are very aware, what a lot of young folks end up with in our communities is that we don't have perfect available for them. And so they end up with very little or nothing. That is incredibly frustrating for me as an advocate in the system for the last 15 years. And so the System of Care Advisory Council in May of 2023 issued a report. It was called the Safety Work Group Report. And it really looked at why is it that our kids with high acuity or complex needs are not getting access to the care that they need? Is it because our system isn't trauma informed? Is it because we have bad funding? Is it, all of these questions sort of, we were open to looking at everything. And we came back from that report with a couple of main buckets of recommendations. One bucket is regulatory reform to build a more trauma-informed system for children with complex needs. So right now we have a lot of folks who have a lot of opinions, implementing those opinions in different ways in different spaces that are confusing, overlapping, create a really complex policy environment, especially for foster parents, for youth who are moving from placement to placement. The rules are different depending on who's paying for your care or which door you went in to get access to the care. And so in order to both make a more trauma-informed system and increase access to services and supports, high quality services and supports for kids who have sort of our highest need in the state, the Safety Work Group report made all these recommendations. We have taken those recommendations and implemented sort of the first bucket and some of the other things that were in those recommendations. I was just looking for the link. I was going to put it in the chat. I didn't want to get distracted while I was talking, so I'll do that in a minute. But I want you to, I will give you access to that report so you can look at it. And so this bill is really following up on the recommendations from that report. And what it really tries to do is, maybe you've heard about it in the news. If you have concerns about it, I'm very open to hearing those. But what it does do is separate the ORS 418 child abuse statutes from the ORS 419 child abuse statutes so that it's clear under which violations or abuse definitions things would be investigated. I know that's very boring, but what it does is makes it clear for the youth and for the families who are involved in the case what went wrong, how are we responding to it, right? And that is part of being trauma informed, that it's clear that it's black and white. Was this thing okay or was it not okay? If I think it wasn't okay, what's going to happen once I tell somebody it's not okay? Right now, that is incredibly confusing and complex. We have 4 different definitions of third-party child abuse. So if a bad thing happened to you at school, it may be investigated as abuse differently than if it happened at your day treatment program. What we're doing with this bill is like, it's one definition. If it's abuse at day treatment, it should be abuse at school. Like, let's stop with all of this confusing and burdensome regulation. And just like, if it's abuse, it's abuse. We're going to investigate it as abuse. If it's a mistake that happened in one of those regulated settings, like there's a restraint that happens and it lasts for 11 minutes instead of 10 minutes, which is sort of the law right now. If a restraint goes over 10 minutes, that's abuse. If the restraint lasts for 11 minutes because the supervisor was in the bathroom and they were running down there, but they got there at 11 minutes instead of 10 minutes of the restraint, we're still going to investigate that. Why did you have that restraint last for 10 minutes? But instead of that automatically being investigated as abuse, it may be investigated now as a licensure or certification violation. So we're tracking it, we're paying attention to it, we're applying consequences for it, but those consequences might look like, supervisor, you need to have another backup on the floor that can certify a hold so that you can use the restroom. Or you need to engage in more training or whatever the investigation leads to, instead of that worker was founded for abuse because of something they had no control over. And now they're not sure if they want to continue to work in the setting. And we have this workforce shortage, blah, 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 right? But it also, I think, gets to this sort of fear that workers have of sort of damned if I do, damned if I don't in some of these settings. And I've heard from foster parents that they're having similar, like, if I let the kid run out into the street, it's neglect. If I touch them, it's abuse. What do I do when the kid is activated? It's scary and I'm not quite sure what to do. So this would create really clear, if it's a parenting thing, if any normal parent who had, obtained their children biologically did the thing and it wouldn't be considered abuse, then you're not going to be investigated for abuse either. If they would be, you probably will be, right? And it's very clear that it can't be used for your convenience, reckless use of force. You can't be saying racist stuff to them, right? Like, it's very, very clear that there are lines and what those lines are. Nothing that is currently prohibited would be unprohibited as a result of this bill. Things would just be investigated differently for where we've seen some of those administrative impacts of like, was that really abuse? It doesn't look like it, right? That might be a training opportunity, a learning opportunity, a growth opportunity, but it may be losing that worker because they're founded for abuse is not what's best for our system. And the other piece is those phone calls back to those parents to be like, your child experienced an abusive hold. Feels very different than your child experienced a hold. Here's what happened. Here's what we're doing to improve the situation next time, right? Like, there's, again, opportunity for repair and therapeutic relationship building in one of those cases and really not in the other case. So that's the lens that we're using. There are a couple of other big things that are in the bill. One would allow very, very limited opportunities for kids to go out of state when Oregon doesn't have the resources to meet their needs. So this is specific to child welfare kids. There have been a couple of times when kids who were involved were in child welfare custody, whether they're with a foster parent or in temporary lodging or something else, needed specialty medical care that didn't exist in Oregon, and it is illegal for child welfare to send those kids out of state to get the care that they need. But kids who are on Oregon Health Plan or in the juvenile justice system can go out of state to get those needs met. So this would just make it fair that those same types of settings that kids on OHP, Oregon Health Plan, or in the juvenile justice system, if it's medically necessary, if a third-party provider agrees it's necessary, if nothing else exists in Oregon, those kids could go out of state to get the care that they need. It would also allow tribal kids to go out of state to get culturally responsive care if their tribe prefers that over the types of care that are available in Oregon. That's been an issue of tribal sovereignty that has been illegal in Oregon for some time, and we have an opportunity to clean that up. And for kids who are in ICPC placements, where Interstate Compact for the Placement of Children, we prioritize placing kids with family members, whether it's an aunt, an uncle. If a kid has moved out of state for that family connection placement and they have a mental health crisis, Currently, they have to come back to Oregon in order to get inpatient or residential treatment for that mental health crisis, either disrupting the placement that they've gotten into with their family member in another state, or disrupting the step down process that happens after you leave a high intensity treatment setting where you go through a number of layers of care that are sort of established in relationship to the treatment provider. So like you kind of have to choose, do you want to get good step down or you want to disassociate with the family that you've just been building relationship and connection with? And it tends to break up ICPC placements either way. And so this is really trying to keep kids stable in those family placements and reduce their risk of bouncing around. The other thing, and I know I've been talking a lot and it's all very technical and boring, but it's important because it really has an impact on these kids' lives. And I know you all care a lot about these kids. Would be that we're separating again the oversight of medical emergency transportation from non-medical emergency transportation. Right now, OHA and DHS both have a role in overseeing both of those, and it's confusing, and there's been conflict around who's eligible and who's not. The intent here is to bring back non-emergency medical transport for kids so that kids who are having a behavioral health crisis can get from where they are to where they need to go in a safe and secure fashion with people who are trained and licensed and certified to do that work. Right now, we're relying on law enforcement in some communities, EMTs in some communities. We at the System of Care Advisory Council have heard some pretty awful stories of kids who are really in behavioral health crisis, not able to get where they need to go, and family members having to decide, do I want to try to drive this kid who's really in a dysregulated state, and I may not be safe for other children, and my car may not be safe trying to get them to where they need to go. Do I call law enforcement and potentially exacerbate the situation or make them even more scared? Like, it feels terrible to call the cops on your kid, right? Like, it's just, there's no good options. And so we're really trying again to create a safe way for kids to get from where they are to where they need to go with high quality regulated providers, which Oregon has lost. So I don't know if there are questions for me or Michelle, if you want to step into your part of the presentation.
No, I just wanted to, there are, like Anna has kind of mentioned, there are individual youth stories or family stories that we've heard that has really been driving factors for all of these legislation points and policy points. So happy to provide any of those if you're curious. The other thing I just wanted to kind of give some technical information. So LC 346 was something that we put together and put out towards to community this beginning of this winter, and really got fantastic constructive feedback on how to improve the bill. There were some drafting errors identified, things that were not the intent of the legislation to get clarification on. So it's actually being LC 346 will not move forward as you've seen it. It will be, it's currently being redrafted through Representative Nose's office. We're working with Legislative Council this week on making sure our policy intents are reflected in the new draft. And so we anticipate actually a bill dropping. My best guess is kind of like maybe second, third week in February. The due date for sure that LC has to get it back to us, Legislative Council has to get back to us, is by the 21st of February. So we intend to see it before then. Lots of discussion going around about this bill. Happy to answer any questions or address any concerns or misinformation you may have heard on this. So we just really wanted to open it up for conversation.
You know, it might be good, Michelle or Anna, to maybe what are you hearing right now as the strongest feedback of people who are concerned about this legislation?
I think there's a lot of fear of just about, I mean, restraint and seclusion are never fun to talk about, right? They're traumatic. They happen when somebody is escalated. Like, it's never pleasant. And so I think we come into this conversation already a little activated just because of the topic. And then as we read really technical language, and there's a lot of mentions in the bill about chemical restraint and prone restraint and supine restraint, and you're reading it over and over again, and it just feels crappy. I mean, like, really, it's gross, right? None of us enjoy that. And so the fears that I think we're hearing are just, is it going to make restraint worse? Is it going to make seclusion worse? Are we going to see an increase in, these sort of traumatic interventions with young people? Our kids, and then with, for specific populations, right? How are we going to make sure that kids who have intellectual or developmental disabilities, who are kids of other marginalized groups, right? So we've got some moms who are kids of young Black boys who have IDD, who are really fearful that this bill will have a very negative impact on their children's lives, both in the school setting and in the IDD group home setting. So it's things like that, right? Like just worries that this is already scary, and then we're talking about it, and I'm scared it's going to hurt my kid. And I'm not trying to be dismissive about those worries. I think they're critical, and every time someone brings them up, we're looking through the bill to find if that is there a policy. Could the policy be read that way? What can we do to make sure that that's not the case? And I know, Alex, you unmuted once and have your hand up, so happy to.
I have
Thanks. Yeah.
concerns about going back to the kind of the bad old days where we'd ship kids out of state to the places in Utah where the agency didn't do a really good job of monitoring what was happening in those placements. And that I think is my biggest reservation about this concept. So what are we putting in there to make sure that that doesn't happen anymore?
So there are a number of checks and balances on that. There are only very limited instances where a young person could be sent out of state. First of all, it could be for medically required care that doesn't exist in the state of Oregon. It could be because a tribe requested and that child is part of that tribe. It could be for an ICPC placement where that kid is already out of state, or it could be for a young person who lives far enough away from the I-5 corridor that a placement setting in Walla Walla or Boise or something like that is much more convenient for their family to be able to participate in family therapy and all the other supports and step downs. There would be a report sent to the System of Care Advisory Council every time a child was approved for an out-of-state placement. It would have to be the director of DHS who approves that directly, or if they're like on vacation, they could delegate that to somebody. But this would only be they couldn't delegate it to like frontline staff, right? It would be one person who's reviewing all of those things. And DHS would be responsible for sending caseworkers out there. Like there's a whole bunch of additional fail-safes, Judge, that didn't exist in the past. And we will be providing public reports, not identifying details of the case. I'm frankly concerned about how many identifying details are already out there, some of the mandatory reports that we provide, but a narrative describing why there was no other in-state option. And the SOCAC will periodically review those to look at, do we need to build an in-state option? Are we consistently sending kids out of state for this need or that need? So then we have a clear service gap that exists in the state. We're expecting this, Judge, to be no more than a few kids a year who are approved for this type of out-of-state placement. I don't know if that addresses your question, but if you have additional fail-safes that you'd want to see, we'd be interested in hearing about those. Alex?
Thanks. So my concern is more of how, as a caseworker, oftentimes new policy or best practices came up, and the actual implementation of that was very infrequently seen. From caseworker to attorneys to judge, just all the way up through the system. And so I guess I'm curious about, I have concerns about the language. You were saying that if a family, sorry, I have a lot of thoughts in my head and I'm trying to get this out correctly. I'm nervous that there will not be the same level. The idea was that families and foster parents, biological families and resource parents would have the same level of what is viewed as abuse or safe. And I have failed to see that over and over and over again. The same thing with other placements. And so just how can you ensure that that's going to happen? Because like in theory, that sounds great, but in practice, it just doesn't happen like frequently. resource parents, facilities were given a lot more leeway in terms of what was considered safe or not for resource parents. I hope that
Interesting.
makes sense.
Michelle, I think that might be a question for you to dig
Yeah,
in.
I guess one point of clarification. So there is and I think Ellen, you were part of this. The House Bill 4086 work group is really looking at the Oregon is very unique in having two separate child abuse statutes. So we have 419B and then we have 418. One of the points of clarification in this bill is really to put in statute very clearly what, as we understand, the legislative intent was for the application of 418 child abuse definitions, which is really on those professional caregivers, not for community members or biological family of children in care. And so that is a key distinction we're making. This would also help with a lot of data reporting to understand when a child has experienced maltreatment in care by somebody who is responsible or has a duty to provide care to that child because they are a child in care. And just a reminder, the definition of child in care is a child residing in or receiving services from a child caring agency, a child welfare foster home, or a DD residential facility. So these are not only child welfare children, these can be community children that are receiving these types of services. And so really trying to differentiate that. Our data is really blended right now, and it really depends on what a investigator or CPS worker, which statute they choose to apply in that situation, which can get really messy. And legally, we just need to have a very clear, these statutes apply because the child in care is a child in care because you have a duty to owe care to them. I know that was kind of confusing. And then all the community is truly for families and for community third-party abuse where there is not that same duty to care because they're a child in care. So I know that's really confusing, but we're slowly trying to clarify this work because it's been so enmeshed and so tangled and really the 4086 work group we hope will further explore this, but I think in the interim before those decisions are made, this is an immediate need for the agency to make this very clear about who the 418 abuse investigations apply to. And I hear you on that and the difference in which resource parents or family parents are investigated differently for abuse. And that really comes down to the point of we are using different in those two settings. And the 4086 work group really needs to have the conversation of, is that what we should be doing in Oregon, or should there be equity in what child abuse is in the state? And that's a really big policy conversation. That is why we have a huge multidisciplinary team and policy expert facilitators to guide that conversation. And we don't necessarily want it to be dictated by child welfare. That's why it's this independent group working on that. But that's definitely a heard concern. But this bill is much more narrow and kind of what we're trying to address.
So very, very small impact, Alex, in terms of the 418. Currently, sometimes Otis can decide whether they want to investigate under 418 or 419. This bill would make it very clear who gets investigated under 418 and who gets investigated under 419. So like tiny progress in terms of answering your question. And then more broadly, when the 4086 work group has done its work, that's when that sort of is abuse different because somebody's paid to care for you or trained to care for you versus they're your parent. And so that is a broader conversation that's not happening in this bill. Does that answer what you had asked?
Yes, thank you for that. Both of you.
Yeah.
This bill isn't trying to allow foster parents to use reasonable physical discipline, is it?
Is it allowing these reasonable discipline? So maybe Donna, you could answer that. So in terms of the actual bill, nothing changes that is prohibited for a resource parent. So physical discipline would still be prohibited. Restraints and seclusion would still be prohibited. When that type of action is not a licensing violation and would be a child abuse investigation, physical abuse still applies to foster parents. So if that is an allegation of physical abuse, we would be investigating as such. If it's a use of restraint or seclusion that they are prohibited to do, like the same definitions that apply to a teacher, that apply to a behavioral health setting, would apply to foster parents as well. And so how we apply that definition would be equal across the board. It can't be used for convenience, discipline, punishment, or retaliation. Chemical restraint is outright child abuse, and then excessive or reckless use of force would be an allegation of child abuse. And so it would be, I would say, like the vast majority would still be investigated for child abuse, Judge. But Donna, if you want to answer, like, there's not much that changes for folks today.
Right. No, I think you hit it. The OARs around requirements for resource parents, related or unrelated, would remain no physical discipline at all for those standards.
But there's in law with parents, there's this huge gray area about what the actual physical discipline constitutes abuse or not, and it comes down to, you know, whether there was substantial pain or whether there was a mark that lasted for several hours, and it's hard even for judges to apply that definition, and it gets litigated all the time. Is this going to make that problem bigger because it applies to more people?
Nope. So this is really only limited to restraint and seclusion definitions. This does not get into physical abuse, which a parent would be investigated for. Restraint and seclusion would not apply to parents in the community. So the definitions for parents remain exactly the same as they are today. This is just for school employees, foster parents, child caring agency staff, DD staff. That should be it, hopefully, the list in my head. So it's making those settings all have, that are using, that have training and restraint and seclusion, that they are all doing that under the same prohibitions, the same definitions of what would be investigated for child abuse.
And then we bulked up a little bit the information for youth around what does and doesn't constitute abuse in this statute, because now we can actually have sort of one, if the bill passes, right? Like, this is what is third-party abuse. And if these things happen to you, you can report it to this person. You can talk to this person. Here's a phone number, right? So that it's really easy for kids to advocate for themselves, as well as like know what the rules are and what they're not. Currently, it's really complicated to provide that sort of kind of consumer information to these young folks that can be empowering to them. And so the System of Care Advisory Council has a group of youth advisors, a few of whom are former foster youth, and they're like, we want to make a video where we like tell kids what's okay and what's not okay, that like they could see on YouTube, and really wanting to help be very clear for young folks how to report a complaint or a concern, as well as make it very clear for all of the adults in the system what's okay and what's not okay, so that they can more confidently engage in the hard stuff of having a relationship with kids who are struggling to manage their behavior sometimes. We don't need more anxiety in those kinds of challenging interactions than we already have.
I think that's really helpful. And because it sounds like the bill might drop sometime before the 21st of February, maybe you can keep us posted. Of course, I'm sure I'll see that. And I can make sure that as soon as that occurs, I can get the information out to all the commissioners. We can discuss it more in February and do a follow-up.
That'd be great. And if any of you, as you read it, once you see it, have concerns, especially if there's I'm worried that would make kids less safe. The door is very open for feedback, for improvements, for opportunities to continue to The point is, let's make kids as safe as we can and get them as much access to high quality care as we can. Let's build learning communities within those care providing facilities and structures so that folks can admit when they've made a mistake and learn and grow from it instead of being afraid about a child abuse investigation. So where you see opportunities to make that better, tell us and we'll work to get it into the bill.
That's great. And so then Michelle and Anna, just as soon as you know something, let me know, and I'll make sure that all the commissioners have access to it so that we can be ready to go on the 24th of February.
Perfect.
Have some
Thanks
good
so much for
questions
your
for you.
time.
Thank you.
Thank you.
I appreciate it.
Yeah, great. We have Ashley next. We're just a couple minutes behind, but she's next on our agenda. Jessica, for updates.
Yes. Welcome, Ashley.
Hi. Well, thank you so much for having me here. I'm going to share my screen if that's all right. I have a few slides because I don't know about you all, but I learn better when I can also have something I can look at. And so I, again, am Ashley Wortman. I use she, her pronouns. I work for the Office of Equity and Multicultural Services within the department. And I'm the Child Welfare Service Equity Manager. Been with the agency for over 10 years now. You kind of lose track after that decade mark, I think. But mostly been in child welfare outside of this position, which I've been in for over 2 years now. And one of my roles is to support the Child Welfare Service Equity Council. So I'm one of the facilitators along with Tristan Fernandez, and who's going to be here today because of all the legislative session things happening. He is one busy person. So you all are stuck with me, and I'll be sure to share the slide deck afterwards for you all as well. So just a quick kind of overview. The Child Welfare Service Equity Council was implemented as part of the agency's Unified Equity Framework. The Unified Equity Framework is really a set of 4 mechanisms that are built to do intentional examination of policies, practices, and really build alignment across all different divisions and program areas so that the agency is moving forward together to really achieve positive outcomes and see equitable service delivery increase. So the Child Welfare Service Equity Council was implemented in September of last year, and I'm just going to share a few pieces of information about how we kind of got there, the charter, membership and recruitment, and then kind of where we're at today. We are a partner advisory with you all, as well as the other advisories and councils that exist as child welfare partners. And feel free if you have questions. I'll keep my eye on the chat, but engage as you feel comfortable. If you want to interrupt me or ask a question, I'm all for it. So I started in my position in November of 2022. And shortly after that, I started having conversations with April Flint Gerner, the Director of Child Welfare, around, how do y'all see this happening? Is there a current group of folks that you want to kind of adjust to fit what the Service Equity Council guidelines are, or do you want to kind of start from scratch? And so we ended up having a all-day strategic planning session in June of 2023, and we invited key ODHS partners like Office of Tribal Affairs, as well as people with lived experience. So we had several parents with lived experience across different intersectional identities, such as fathers and tribal members, among others. And we kind of had a conversation where if you could have this council look and be anything, what would it be? And then we started paring down, obviously, things that were realistic and things that aren't, because we are a government agency. And then we really applied project management and implementation science principles to continue building on that vision that came out of that space. And that included identification of roles and responsibilities, which is why I'm still here helping to drive this forward with Tristan, among others. But we wanted to make sure we had a solid footing before we really jumped in. And so from that strategic planning space, we created a steering group. And that steering group included primarily people with lived experience who are not agency or ODHS employees. And a couple of those are listed on the slide, like parents with lived experience, tribal government representation, community partners. We had a consultant from Casey Family Programs. And then of course, we had to have a couple of child welfare and ODHS partners. But they really focused on developing the components that would be built into the charter for this council. And they identified 2 core values that they wanted to really be the foundation of how we built that, which was to share power differently and to decolonize that council environment and its processes whenever and wherever possible. Really acknowledging that within the systems, there's a lot of racism and oppression and other hierarchy and positionality pieces that kind of get in the way of being able to do the good work that folks want to be able to do. And so I really had a few key goals that they looked at for that charter. Essentially, Tristan and I just gathered all their wisdom that they talked about, and we put it into the charter. So we did not drive it. It was driven by folks with lived experience and tribal members, and they identified the purpose and vision, what membership would look like and what roles and responsibilities folks had, how we recruit for membership on the council, how we onboard, because one of the things they told us was you will get folks in seats as an agency and you don't prepare them to actually be kind of competent in all of the agency stuff or understand the structures of the agency. And so they wanted us to make sure we had an onboarding process. And then they mapped out what the council meeting structure would look like. And then we also celebrated all that great work that occurred over about 6 to 7 months. And then they identified ways to sustain this council. They really didn't want it to be a check mark or something that is just in name only. They wanted to really create an opportunity for this council to create a legacy and how it helps support change within child welfare. So this gives you just a quick snapshot of who sits on the council. We have 2 slides. So there are 19 members total. 15 of those members are non-ODHS employees, and they are people with lived experience. And they identified specific seats that they wanted to make sure that they had representation from, while also recognizing that that isn't the only wisdom or expertise that those folks are coming with who sit in those seats. So also building an opportunity to share additional lived experiences and wisdom with the council as they are in their membership. So we had representation from the 9 federally recognized tribes of Oregon and tribal government partners, identified a key need from community-based organizations and partners, and then also looking at communities that are disproportionately impacted and affected. And they outlined key seats that they wanted to make sure were represented. And that last bullet point on that at the end of the slide is actually something that was really unique and pretty cool that they embedded, which was 2 members, one from each of the most overrepresented populations in the child welfare foster care system. So right now that is the Native American Alaska Native community and the Black and African American community. And then as those 2 seats come open for recruitment or their terms turn over, we will utilize the current data to then recruit for those seats. And then the ODHS members are just 4. We have the Director of Child Welfare, their designee, the Director of OEMS, so the Office of Equity and Multicultural Services, or their designee, the Director of Tribal Affairs and their designee. And then we created a rotational seat for the lead program manager that represents the area of focus or priority that the council is wanting to really divert their attention to. And one of the ways that they share power is that ODHS members who sit on the council are not voting members. So the only voting members are folks with lived experience who fit that previous slide. And then another thing that they shared in the steering group when they were building the charter is they said, we don't want to have a hierarchy within the council. We don't want a chair or co-chair. If we are here, we want our full attention focused on how we're moving the work forward and what we want to do in this council. Those administrative, duties and responsibilities that usually are given to a chair or co-chair, we want ODHS, you need to own those responsibilities. So we're responsible for facilitating the spaces, co-designing agendas with the members, posting that information publicly. This is not a legislatively required council, so it's pretty flexible in how we were able to build it, but it does meet public meeting law. So we do have a public website, which I'll make sure is posted in the chat shortly. And then for the recruitment process, this was again designed by that steering group of folks who mostly were not internal ODHS folks. But they said, we want to have a really intentional space because folks are bringing their lived expertise, their wisdom to this space. We want to make sure it is something where they are valued and really lifted up during that process, and we have the right people in that space. So we start with an interest form. It's very brief because they said that often we share too many words and too many things as an agency. And so they said, we want just a few key questions that you need to know. And that's it for that part of it. So we have a review panel that undergoes a bias kind of, overview and conversation before we review. It involves folks from our partner agents or advisories as well. So Malik, I'm looking at you because you just recently participated with us and partnered with us, which we appreciate, and other folks as well. Then when we move those folks forward and we score with a matrix and do all that, phase 2 involves an information session where those applicants can come and learn about the council, kind of do that deeper dive that's often in an application but isn't in this process. And so then folks get the opportunity to say, yep, this is what I really want to do. I want to continue in this process. Or they can say, I had no idea I was signing up for this and I don't want to be a part of this anymore. So that autonomy right there. And so then the last phase of the recruitment is we have advisory partners and ODHS leaders come together, and they essentially are working through and deciding that membership selection. And we have also done some background work. So Ellen, myself, and some other facilitators of different advisories, identifying opportunities that we can then connect those folks who are not selected to continue to partner with child welfare because they're invested, they want to do the work, they want to be a part of it. And so we don't want to just say, sorry, see you later. We want to say, not this time, but here are some additional opportunities that may exist that you might be interested in. So our onboarding process, again, they said you do a really crappy job, ODHS, of setting us up for success. So we want you to own this process and we want you to do a better job. And we listened. And so what we do is we have a overview of the organizational structure of ODHS. So we talk about, what does it mean for shared and central services? What are the other divisions that exist? You have, I think we're up to over 11,000 employees now. What do you all do? And then we also provide an overview of child welfare structure because there's a lot of moving parts in that division and it's very large. And then we also provide some other key documents like an acronym guide because we like to talk and throw around those acronyms a lot. And so we want to make sure that folks feel a little bit more empowered to know what we're talking about. And then we are required by policy to go through the ethics training. And then there's a couple of other ones like mandatory reporting and things like that that folks have to be aware of. They do have the opportunity to observe a regular meeting if they would like to. And then it's also, we build in some relationship building so that they can also get comfortable interacting with the other council members and Tristan and myself as the facilitators. And we do offer reimbursement, super important. And so that process that we were able to figure out after many, many conversations, because it's a complicated process in this government system, is the honorarium process. And so we have the Department of Administrative Services and some other policies in Oregon that they have to follow, and members can choose to opt in or opt out. We encourage folks to ensure that they are also, if they are attending as part of their job or their organization, that they consult with their HR or other areas to ensure that they're not violating conflict of interest or anything like that. And then there's some required documentation, and we submit the reimbursement process, or excuse me, the request for them. And essentially they receive a check from the department for their participation. And the purpose of the council is to provide recommendations to the child welfare director based on their key annual priorities. So the two areas that the council is currently focusing on are family, kith, kin, and in-home service delivery, which includes exploring family preservation and family first. And then secondly, bias, assumptions, and decision-making, which is looking at all different intersectionalities. So looking at bias towards fathers and other things like substance use disorder, mental health, things like that. And so right now they're in the information collection phase, which is where we're inviting key folks from ODHS to come and speak about different projects or pathways that they're building to that are directly connected to these two areas. And so our goal is to provide council members with enough information that they feel confident in then drafting recommendations to the child welfare director. And within the charter, the department is required to follow up with the council about where those recommendations went. And if for whatever reason they are not able to move forward, there is to be very clear transparency about why that couldn't move forward. Or, you know, maybe a part of it could move forward, but there's another law that's in the way of moving forward completely. And so really being transparent around what needs to be broken down in order for that recommendation to move forward. And I have my contact information, and Tristan's on the slide, but appreciate the time to come and share with you all just a little bit of information about the Child Welfare Service Equity Council. I'm sure as we continue moving forward, we only meet every other month, so we've had 3 regular meetings at this point, which have been really great spaces, and lots of information has been shared, and they're finding a lot of value and opportunity in it so far. Happy to answer questions or whatever y'all would like.
Great job, Ashley. Exciting to hear what comes out of it.
Thank you. Thank you. Yes, exciting. It's been an absolute honor to be walking alongside this process, and just the amazing relationships and wisdom and just wonderful humans that are in that space. It's been truly an honor to be a part of it.
Thanks so much, Ashley. I'm sure we'll be seeing you again here in this space and get follow-ups.
Yep, definitely. Thanks for having me. Happy to come back anytime, and I'll send that PowerPoint slide deck and a PDF over to you, Ellen. So
Thank you so much, and I'll get it out to everybody in our follow-up. Okay.
Awesome. Thank you.
Thank you.
Yes, thank you, Ashley. Okay, moving on to the next. If nobody had any additional questions, it looks like we're allowing 3 minutes for each commissioner to give an update or any kind of requests.
Yeah, this is just something that we discussed as being, you know, if anybody, we'd have a few minutes for commissioner updates. Also, I don't know if Rachel's still with us. She might have signed off. I'm not seeing her on there. Normal, and sometimes we have our ELT updates, but because we don't have anybody from the executive leadership of ODHS or from Child Welfare Today, we'll probably be doing that in February and just be doing that every other month as we discussed. But anything anybody has right now that they'd like to bring up, discuss, then we'll have some time right after that for public comment too. So
Well, just a question, Ellen. I know that when we discussed in November, we've been struggling with quorum for a while, switching these meetings to monthly and only using a half an hour of kind of work time here. Have you been able to connect with anybody? Was this more amenable to people? Because we're missing a large amount today as well. I was just wondering if this is going to be helpful or not.
well, I hope so. We're actually only missing 3. So we have Dean, who I thought was going to be coming. I'll follow up with him. We have Alicia, and I was not aware she was going to miss. She's the person who's been normally, as you know, taking notes. And we have Pamela, who actually had to do a presentation today and didn't realize it was going to interfere with this meeting. So we're missing 3.
Is Seema no longer on the commission?
No. She only attended that one meeting last, when she had come on and then had a conflict.
Our list is pretty outdated on our commission.
Yes. We'll get that taken care of. I've talked with SharePoint about it. But because we're going through our big changeover in April, we're just going to wait till then to shift everything. We've had some people shifting in and out. So it's been, rather than try to keep changing it monthly for them, we're just waiting. We thought we would just wait until we know who's going to be coming on in April. So, but if anybody would like us to do, I mean, we could get that done right now if you have that suggestion. That was just kind of the way we left it. Any thoughts on that?
I just noticed because I was looking to see who we were missing today.
Yeah. Yeah, it's very sadly outdated. But we had a lot of shifts this last year. And then hoping to get the commission full has been a goal, and to get ourselves new, interested, and energized participants to keep doing this important work. And we're super happy to have Judge Jaco back. That's been great because we really missed you.
I'm glad to be back. I am a little bit concerned about LC 346. So as soon as it gets a VIL number, would you let us know? Because I want to look at the details.
I absolutely will. I'll send that out. And it looks like Ashley has already sent me the slides, so I will get that out too later. But the 346, I think, will be a little bit later. It looks like Michelle wanted me to post the Omnibus Executive Summary. Some of you may have seen it in the chat, but then I think there are some issues with it. She just said with the access, or there's some challenges opening it up. So when she has that, that'll also be something I get out to you all, so you have a copy of that, those 2 things. We'll get those out very soon. So I think those are the only 2 things from this meeting. We'll also, Casey, follow up with Alicia and Dean. Alicia, Dean, and we already know about Pamela, so just Alicia and Dean.
Is the expectation around mid-April to confirm
the Senate confirmations are in April, and they'll be for your reconfirmation as well. And Malik, maybe I think next we talked about February bringing on their names are escaping me, but the 2 people that we spoke with that had the trafficking, some of the issues with trafficking that you have worked with. Do you want to say a few words about that?
Yeah. I both obviously work with New Avenues. We have a program called New Day that works with youth that are impacted by trafficking engagement, as well as a program, A Village for One, which offers a BRS facility specifically for youth that are CSEC. And so I was hoping that they can come out and talk about, because we both work with youth that are in the system specifically, and kind of just like what the work has been looking like, and kind of trends that they're noticing, things like that. And so I was hoping that both of them from both programs could come and chat a little bit. So, but I can connect with them and see if they're. Did you want them for February or for March? So I know we were trying to push it back, so I wasn't sure.
So maybe we could go with March since it looks like we'll have some stuff for February already in a short amount of time. But I think that would be great to hear from them, and I'm happy they want to come and present the
Okay,
things they've been seeing.
perfect. I will
Um,
connect with them and I'll CC you on those emails as well, Ellen, and go from there.
yeah, that's fine. And I just wanted you to know that it hadn't fallen off my radar screen, and it's important work. So thank you for bringing that to my attention. Jessica, do you think we should go ahead and just go to public comment now?
Yes, I agree.
Do we have any public comment? Victoria, did you have anything? Or any of our visitors, please feel free to weigh in.
Hi, yeah. I just wanted to say I do attend a lot of SOCAC meetings, and I think the intent of LC 346 is just to make sure that we're not losing providers and care facilities due to, these just mistakes that do happen that, we could look on and make just make amends and do better, because there is so much, I think, fear within the system of care, within residential facilities and within resource homes, that, there will be false reports, or that, you'll make a mistake and then suddenly you can't ever work with children again. I don't think there's any intent to allow for any type of abuse. I think it's just there aren't enough providers. It's hard to recruit and retain resource parents and facilities and the care providers when there is such a fear of allegations coming up and, having your license be removed for life, when obviously the intent is to be helping these kids. And then the other thing I wanted to say is, I think a solution for the lack of care facilities that that we have for especially, higher needs kids could be creating more sustainable communities for resource parents that have on-site crisis intervention, like 24/7 crisis intervention, so that resource parents can keep their kids in home without, having to worry about, oh, well, what if, they're having a difficult time and I can't put a restraint on them, but I don't want them to hurt themselves or the other kids in the home. That way, hopefully we could find a solution that would be able to give kids the stability that they need to thrive, and hopefully, have other on-site supports like therapy and support groups and enrichment like art and music and animal therapy and things like that. I think a great example is Bridge Meadows, and I think we can expand upon that idea to give kids the support and stability that they need.
That's great. Thanks for that, Victoria.
Thank you.
Appreciate it. Do we have other public comment? Matt or Rory?
Well, I can't say I have anything helpful, but it's been good listening, and I'm kind of researching a little bit as I'm hearing these things come up so that I can be a little more informed. But yeah, appreciate you letting me listen in today.
Thank you for being here. Thanks.
Okay, if there's nothing additional, then we can wrap the meeting up. We appreciate everybody's time today and collaboration always. So thank you for our presenters with all of the great information. And Ellen, did you have anything else that you wanted to add?
Nothing else. Thanks, Jessica, for stepping in and just doing such a great job at the last minute.
Sorry, it was a hot mess.
No worries. And anything else anybody has, feel free to email me. And we'll go from there. Casey, you and I'll follow up on some of those things that you brought up. And we'll look forward to seeing you in February on the 24th.
Thanks,
And
everybody.
yeah.
Welcome,
and same thing.
Victoria and Matt.
All right. Thank you.
Bye.